can prevent even the most knowledgeable clinician from putting his experience into practice. When drawing up a plan of examination for examination and treatment, it is very important to take into account the peculiarities of a specific situation, of specific temperamental characteristic, patient's temperamental characteristic, in order to reject those tasks that will be impossible or extremely difficult to solve. We can, or you can be sure that some treatment methods that require special care and endurance are not suitable for every patient. So, for example, the diets or exercises complexes recommended by doctors are not followed in most cases. In this case, doctors are themselves waiting for patients to recover after they prescribed course of treatment. This does not allow them to use other tactics of treatment and prevention, like surgery, operation, or drugs, and etc. Knowledge of the characteristic of the patient's personality allows us to predict his behavior in treatment, in management, in general management, and to propose such tactics, such plan that will be not only pathologically justified, but also visible for our patient, for this particular situation. The doctor has to work in an environment of intense competition of opinions. Sorry. A sick person receives an incredible amount of advice from his relatives, from neighbors, colleagues, the page of popular magazine, internet, TV shows, or not professional healers, and so on. Turning to doctors, he is faced with a lack of unity of opinion among various specialties. Therefore, a professional doctor must make sure that his point of view is the most attractive, that he saves the patient from the incompetence of ordinary people. There has been a lot of talk lately about the commercial effectiveness of medicine. The use of psychological techniques, this using makes it possible to increase the authority of official medicine, to attract patients found to support those medical institutions that provide real assistance in the fight against the disease. Refusal to use psychology can lead to the fact that that the best hospitals will be deprived of funds or for their work, losing in the competition with the unprofessional and incompetent by psychological gifted practitioners. Sorry. A doctor or specialist, yes, who takes offense at a patient for rejecting his advice is likely to be oblivious to his psychological incompetence. Doctor doesn't care enough to ensure that his opinion is presented to patient in the most favorable form. And this form means that he is not professional enough. Very often, in order to persuade the patient and his side, it is necessary to call his relatives as allies. If relatives act as opponents of the doctor, one cannot count on the success of the treatment, of the management. Psychological research methods in the clinic. It is very important part of medical psychology, because you know that without researching, without science work, it's impossible to improve your knowledge, impossible to improve your professional skills, your professionalism in general. Of course, the main methods of psychological research are observation, interview, and experimental psychological research methods. Of course, I'm sure that you have already knew this information because you successful passed exam, and this is one of the questions from the exam. Yes, for example, types of interview and so on. But we just remind this information because it's very important for medical psychology especially. First of all, observation. What is it? It is a study of psychological phenomena without interfering with their course. Everyday observation is first kind. Yes, everyday observation is limited to registration of facts, has a random or unorganized nature. Sorry. Scientific observation, second one. Organized, has a plan, very systemized, has a strict structure, fixing the result in special diary. Next one is participant observation. Participant observation means involves the participant of the research in the activity that he is studying, specific area of research. Then observation not included. Doesn't involve the participant of the research. The observation method is the most fundamental method of psychological research. It consists in the professional registration of all manifestation of the internal psychological structure. This internal psychological structure revealed in the external behavior of the subject. It is very important to take into account yes, that the role, the main aim of the observation method is increasing with suspicion of simulation and dissimulation. Sometimes very important question, especially in the psychiatry, yes. The next one is interview. And interview is a method of obtaining information about the individual psychological properties of a person or psychological phenomenon, symptoms, syndromes, the internal picture of the disease, the structure of patient's problems, and so on. You can read the definition on your screen. Objectives of the interview are the identification of actively submitted compliance, then assessment of individual psychological characteristic of person and referring them to psychological phenomena of psychological symptoms and syndromes. Next one, objectives of the interview is establishing a relationship of trust. Next one, revealing and hiding motives of human behavior. All subjects help us to help them to find the help of formulating the problem, the main idea of even its research work or even its treatment of some psychological problems. And very important to understand the main reason of the altered state, the psychological state, and so on. And of course, psychological support. It can be one part of psychotherapy or consulting or just separated support, but it's very and very important, especially in this area. There are several functions of interview. Yes, if we continue to speak about interview, it's necessary to say that we use interview for several purposes and can be differentiated into diagnostic and psychotherapeutic form of interview functions of interview. When we speak about interview principles, about interview concept, we should mention that interview principles include several criteria, several components. Yes, first of all, it's an ambiguity and accuracy. What does it mean? It means correct formulation of the questions. Especially, it's very important in psychiatry. For example, imagine that your patient is a very suspicious person. For example, he has paranoid personality disorder, yes, and so on. And suspiciousness, the main criteria, main symptom of his personality. And if you will have mistake in your question, and if you will give incorrect questions, patient can, of course, his condition can be changed, and he can have suspicious about you, that you maybe wants to do something bad for him, or you have some bad ideas about him, and so on. You should care about your questions. Yes. Then the second one, is accessibility. Accessibility means taking into account in patient's account or doctor's account, the patient's level of knowledge, his vocabulary, his culture, his educational, his interest, all his specific characteristics. Yes, it's very important can help you to build your interview, to build your communication with the patient, and it's very necessary. Then second one, it is algorithmization. What does it mean? It is a sequence of questions, and this question is based on knowledge, a specific knowledge in the field of compatibility of symptoms, for example. Yes, if we speak about psychiatry, or it can be knowledge of psychogenesis, for example. Yes, it can be knowledge about different types of response, for example, endogenous disorders. Yes, when we speak about, if we speak about psychiatry, it can be psychogenic or exogenous disorders, and so on. When we speak about algorithmization, it's very necessary to mention that level of disorders, I mean psychotic or non-psychotic disorders, is very important here, because according to main symptoms and syndrome, you can choose the main idea of your interview, the main concept of your interview. Yes, if you mean non-psychotic disorders, of course, you know that it's a neurosis. different forms of neurosis, and you, of course, you know that they are associated with stress-related disorder, and of course you must pay your attention to this this cause, sorry, for stress and associated and so on. And if you speak about psychotic disorders, of course you should know about delusion, hallucination. You should care about this, because patient can be dangerous, his behavior can change very quickly, unmotivated behavior and so on. So according level of disorders, we can build our interview. What else? Of course, checkability and adequacy of interview. We have already discussed about adequacy of interview, yes, of principle of questions. The same principle of adequacy of interview too. Next one, it is impartiality. Impartiality, what does it mean? Of course, it's exclusion of imposing your picture of symptoms on the patient. What does it, how to explain in the clinic? In the clinic, you should care about your questions, of course, of the interview. Yes, when I speak about interview means, of course, questions, first of all. You should choose very soft, very clever questions and terms inside your questions. For example, it's impossible to ask a patient, have you thought about suicide? Even he didn't think about this, he must think that you must think about it. Yes, you must analyze the situation and so on. You can ask, separate these questions, but not strict questions like, have you thought about suicide and like this, or about about suicide. It's not. So it's the main principles of interview. Now let's begin discuss the structure of the interview. Of course, there are a lot of opinions about structure of the clinical interview, a lot of techniques and methods of interview, and you can choose the most useful, the most productive forms of interview, but I want to explain you one of the more common forms, form of Mendelevich interview, according to Mendelevich. This structure of interview includes four stages. First stage, it's establishing or a confidential distance, providing guarantees of confidentiality. Sorry. What does it mean? You right not to speak. You can speak. You can use this phrase in your interview. Yes, I mean this. You write not to speak, or it is not easy to ask such question. Everything that you want to share will remain between us. So the examples of the first stage of interview. You can begin your interview, your communication with the patient using these words, using these sentences. Yes, you must pay his attention that everything which, all information which you perceive, which you in this interview, you will save, and you can't share this information with somebody else. Yes. The second stage is identification of compliance. Also in this stage, very necessary to understand and analyze the internal picture of the disease. Later in our lecture, we'll discuss with you what is the internal picture of the disease. You will understand what is it. And also very important to analyze the structure of the problems, the purpose, the basis, sorry, of the problems. in the rhythm and piece that is conventional for the patient. That's very important for the patient in this stage. The third stage is the evolution. Evolution of the desired outcome of the interview and therapy. For example, you can ask patient, how did you imagine our conversation? Or you can ask him, what do you expect from it, from our conversation, from our therapy? Or you can ask them, how do you think I could help you? So in this question, when you ask, how do you think I could help you? You let his consciousness and unconsciousness level to work and help him to give you the plan, the scheme of the therapeutic work, for example, and the fact that patient gave you this plan. It means that this plan will work because it's development from his consciousness, from his unconsciousness, and it means that he can work according to this plan. It will be more simpler for your patient to work according to this plan. The next stage is the second stage of interview. It is assessment. Assessment. Sorry. Assessment of the patient's anticipatory abilities, discussion of probable outcomes of the disease, or it can be anticipation training. For example, the basis of the assessment of the patient's anticipatory is a thinking out of the most negative consequences of his illness, what the prognosis he has to analyze his future. It can be the second stage of clinical structure of the clinical interview. The experimental psychological research method of medical psychology allows us on the study various links of mental processes and states. Dear students, we will work without the rest. Okay, we will finish soon. It's very short lecture today, first one, because of this we please try to find power and we will finish soon. So, about techniques of psychology. Medical psychology, as I told previously, one to study various links of mental processes. Numerous psychodiagnostic techniques in most causes are multifunctional, and they allow to study several functions using one technique, and can be very unique technique to analyze. So, for example, when you will have practice class, we will discuss with you test called method of pictograms. Yes, and this method helps us analyze several cognitive components. So it's very unique forms, and using the one test, we can make a good results, have good results, sorry, and analyze both cognitive mental function. There is no single approach to creating a classification of individual methods included in the experimental psychological methods. Currently, the following techniques are distinguished. Sorry. First of all, it's qualitative. What does it mean? It means aimed at identifying the qualitative patterns of mental activity of patients. Then, psychometric characteristics. Psychometric characteristic of psychological methods. It's used to measure certain functions, for example, level of IQ, for example, level of his interests and wishes, and so on, very specific, or level of his knowledge using specific cards or cubes and so on. In our practice classes, we will discuss this. Then, verbal characteristic. Verbal means using specific verbal stimulus and materials. For example, there is a list of proverbs which we use for the patient, or there is a specific like a Bourdon test. Yes, includes specific symbols or terms or letters and so on. Then, next one's non-verbal, the stimulus material on which is presented in the form of drawings or diagrams or various colored cubes and tables. It can be different forms of techniques, and very often we use them therefore specific cognitive components like attention, like a memory, for example, method of pictograms, which I told you previously. Specific picture, just a picture, patient will draw something, not important his quality of drawing, but he must draw, or specific cards with specific object and shapes which we use for measuring his cognitive components. Sorry. So conducting by an examination, conducting an examination using experimental psychological techniques includes several stages, 3 stages. Yes, it's collecting data in accordance with the research objective. Of course, yes, it's impossible without this. Then the second stage is processing and interpretation of the received data in particular situation. And the final stage is making a diagnostic and prognostic conclusion. Of course, it's the 3 main bases, but as my opinion, I can combine with the consultation with specific specialties. Yes, because according to test, you know that we can't put diagnosis, we can't use this material information for diagnostic system, but we can analyze his condition and can make recommendation and make more deeper investigation. Investigation in one specific area. For example, when we work with him and we see that he has problems with intellect, of course, we can make a pedagogical consultation or psychological, or make more specific tests in this area and so on. Because of this, it's better to combine with the fourth stage of psychological techniques. Then, in each case, not only in psychological and psychiatrical case, do the specialist psychologist, yes, we call psychologist, uses a limited number of parapsychological, experimental techniques. Usually we use over 8 or 9 methods, techniques, and them combined into so-called battery of techniques, battery of the methods, and so on. The necessary techniques are selected in accordance with the research objectives. Possession of as many experimental research techniques as possible allows in each case to select the most adequate techniques that will comprehensively characterize the main characteristic of the subject's mental activity, and in some case, in some situation, confirm each other. Of course, there are a lot of methods. Of course, you can use all of them, but you should choose them according to the main aim of your research, of your work with the patient, according his condition, his temperamental culture, and so on, and according to your practice and your knowledge, because you should know, not should, you must know how very well this test, you must analyze the results, you must have a good practice in this test. Yes, even it's very modern test, you have practice before you will work with your patient. And what at the end of our lecture, I want to the last ideas of our lecture. I want to explain you that the process of the research of the subject, even psychology, even psychiatry or another specialty, in most cases, it is advisable to use methods of increasing complexity from simple to more complex. It is very necessary to use only well-known, as I told previously, well-known and proven psychodiagnostic techniques. The use of all kinds of new or original or modified techniques is possible only in the case of complete confidences in their validity and reliability. And the last idea, that the use of any psychodiagnostic techniques should be preceded by its careful study by the specialist himself. So that's all, the end of our lecture. If you have any questions, you can ask me. If you don't have any questions, I wish you good luck and see you on our next lecture after 2 weeks. That's all. Our lecture is finished, dear students.
Thank you, madam. До
Thank you,
свидания.
madam. Thank you, madam.
You're welcome.
До свидания, madam.
Goodbye.
До свидания, доктор.
Goodbye. Мне просто